Till the ordinance committee has a chance to do their work and come back.
So some of the big questions, there's a lot of questions, a lot of issues to talk about. Mayor Blum, let me start with you. Santa Barbara has something called the Medical Marijuana Dispensary Ordinance.
Yes.
Tell us what that is and what the status of it
Well,
is.
last April, it went into effect in 2008, and what it does is talk about the siting of medical marijuana dispensaries, where they can be, mostly away from children, parks and away from schools and that sort of thing. So the bottom line is it looks at the whole city of Santa Barbara, and it's only in the downtown area, Milpas, a very small area on the Mesa, and on Upper State Street, where we can cite them. And then it talks about security and no smoking on the premise and all those sorts of things. We thought at the time it was a good ordinance, but we need to look at it again. So that's why it came to the City Council recently. And so we sent it over to the Ordinance Committee because we're finding dispensaries popping up in these areas, huge numbers of them. We could have like a bar scene, that we have on Lower State Street, but of medical marijuana dispensaries, because there's no limit to the number that can go into these areas.
So, yeah, we have some neighbors unhappy about that. I know there's some folks in the audience that want to ask about that. Mark Russell, let me ask you, you operate a collective out of your home in Goleta. Tell us what that is, and also how does the regulation in Goleta differ or is similar to Santa Barbara?
Well, as far as how we operate, we grow 96 plants for 16 members. That's 6 plants apiece. We provide those patients with a reasonable amount of free cannabis. Seems fair, small enough just to get efficient and figure out what works for our community. We've been operating since 2005 and haven't had any complaints from neighbors because we're good neighbors. And then as far as the ordinance in Goleta, it's the ordinance in Goleta that was proposed to City Council wasn't regulations. It was a ban against them completely, which we're definitely not in favor of. But,
so there's essentially no regulation in place now.
There's a current ordinance that after the interim ordinance was about to expire, city staff had presented City Council with a proposition for a ban associated with criminal activity. City Council didn't believe them and basically had to approve the ban because if they hadn't, the temporary one would expire and then they would be free to open. Right. City Council had instructed staff to come up with regulations, which they're supposed to talk about mid-September.
Mid-September. Penny Jenkins, CEO and President of Council on Alcohol and Drug Abuse. What's your perspective on this? What are your concerns?
My concerns are mostly with kids. I think that if medical marijuana is necessary for adults for problems that they have, it should be regulated. I agree with the man that was talking before. It would be great to come through a pharmacist or under some kind of really regulations that were all the same, not vary so much. As far as kids, though, there are an awful lot of kids that are getting marijuana. And I run the Daniel Bryant Youth and Family Treatment Center. 87% of the kids that come in there started on pot or are still on pot. We have the Cannabis Youth Treatment Program for kids that are addicted. So there are a lot of negative effects, and I'd like to keep the kids from having it. I'd like to get the community to work together to keep kids from getting the marijuana. Now, a lot of dispensaries don't sell directly to them, but someone else goes in and gets a card, gets the pot, and sells it to the kids. A lot of kids have gotten their own cards because they have backaches and that sort of thing, according to the superintendent of schools.
Okay. JoAnna LaForce, you operate 3 dispensaries in L.A., and as I understand it, you've applied for a permit here in Santa Barbara. We were talking before the show. You said Los Angeles is kind of like the Wild West, something like 800 dispensaries. What's the difference between that here and here in Santa Barbara in the way that operates?
The biggest difference is the city of L.A. has not, to this point, even established a permanent ordinance. They keep renewing the interim control ordinance, which is over in September. So what that does is it allows people to open up wherever they choose to. Many of them have, 6 or 7 operations going on. I mean, it's a really wild west, and they're saying, well, there's nothing there, so we're going to try to get in and make as much money as we can. And if we have to close, we have to close, which is really, really bad thing for people who are doing it right. And the nice thing about Santa Barbara, I've lived here for 17 years, is that they they acted. They were proactive in establishing an ordinance. It may not be perfect, and we do need to look at things like, distance between dispensaries, a cap in certain areas. We don't have just all one saturated areas, but give those dispensaries that have a really wonderful model to be able to participate in the community, especially with education. My goal is education is everything, and take the political and economic importance out of cannabis.
I want to build on something that Penny said, her concern about kids. We got an email from a viewer who says, apparently standards for issuing medical marijuana prescriptions are lax or non-existing. I just heard of someone who went into a local doctor's office where they regularly issue medical marijuana cards. He paid $160 cash and then was asked to fill out a form indicating his problem, which was back pain. Then he was ushered into a room with 4 other patients. The 5 patients in the room were interviewed by a doctor about their illness or pain for several minutes. The interview was by video conference. The doctor was in another town in Santa Barbara County. I support medical marijuana and would support legalization of marijuana, but the apparent hypocrisy of the prescription authorization bothers me. Mark and JoAnna, let me ask you, what is the process for someone getting a prescription or coming to you with authorization to do that? How does that work?
Well, it's actually a recommendation from a doctor saying that a patient would benefit from the use of cannabis. They would bring in that document to a collective, an establishment that would be a provider. We would call the doctor and verify that the document was in fact legal. It did come from a licensed physician in the state of California. We verify that the doctor is in good legal or good standing with the California Medical Board by having a current license, and then they're free to join as a member.
JoAnna, what's your experience?
The concern really is with the recommendations too, and we're in a very infantile timing with regulations, and there are always people that are wanting to take advantage because of economics. We do have physicians. Being a clinical pharmacist, I'm working with physicians and establishing standards for physicians, continuing education, certification to be able to recommend cannabis, and that's where it has to go.
So, Penny Jenkins, here you have 2 people of good faith talking about how it operates, but your concern is that this has been essentially de facto legalization, is it not?
Yes, it has been. And kids can get pot on the streets. They can get pot from anybody that has a card that goes in and buys it for them. They go in with their parents and get pot. They can get it in school. A lot of kids in school. Brian Sarvis, I don't want to quote the exact figure, but it's a large amount of kids that have cards in the schools, and they have gotten them for back problems or whatever, and they become problems in the schools. They're much more lethargic than some of the other drug abusers, but it is they get them for learning disabilities, supposedly, and it's a huge problem with the school district. It's a huge problem that any kid can get it from either another person, or some of them actually look like they're 18 and don't have to provide verification. Every operator is a little different.
Yeah.
Jerry,
Go ahead.
Jerry, when you're talking about kids under 18, you're saying are able to get those. I think the real problem is the illegal black market. I don't know of any, as far as my collectives, and I know Mark's, and most of the people that are doing that right are very meticulous on who they let in to the dispensary and how they can become a collective member. Because it's like any medication, they do need education on taking it correctly. So I think, and I know in my collectives, we regulate how much a person can actually even procure. So it's for personal use only. So I think that it's coming from other means than the dispensaries. And I think that's what we really have to look at, is that illegal and black market.
JoAnna, can I say something to
Yes.
JoAnna? In that I think you're right, there is a black market, but there's also a lot of kids that are